Second match. Acha.
First was won by the NSUD team last week.
Okay. Who were they playing?
They defeated the PIC.
Sorry, PIMS Leopard. They defeated PIMS from Islamabad.
नहीं PIMS कहाँ PIC था last time.
नहीं PIMS था.
PIMS था अच्छा.
Sir, PIMS था PIMS Islamabad.
Okay. Yeah. I think we should start now.
Sir, अगर इजाजत हो तो
Assalamu alaikum everyone. I'm Hamza Hussain from Wilson Pharmaceutical. On behalf of Wilson Pharmaceutical, it's a great pleasure and honor for me to extend a very warm welcome to all of you who are present in this second match between two teams from Group B, Khan Star, AKUH Stars and HMC Stallions. First and foremost, I would like to introduce the senior faculty members who has joined us for this second match. From Governing Council of Cardiac Super League, we have with us Professor Fateh Ali Tipu. Professor Fateh Tipu is Professor of Cardiology and Director of Cardiac Residency Program at Aga Khan University Hospital. Sir, thank you very much. He is also General Secretary of Pakistan Society of Echocardiography. And from the umpiring, today I am honored and humbled and overjoyed at the same time that one of the most famous cardiologists of UK, who has trained numerous cardiologists in Pakistan, Dr. Suhail Khan, has joined us as an umpire of today's match. Sir, I'm very much thankful to you for giving us time for Cardiac Super League second match. And from the guest panelist, we have with us Brigadier Asif Nadeem, who is Associate Professor of Cardiology at National Institute of Heart Disease and Armed Force Institute of Cardiology. And another senior member, Professor Isaaq Saab, has also joined us. He is Professor of Cardiology from Karachi Institute of Heart Disease. He is also Chairperson of International Society of Hypertension of South and Central Asia region. And last but not the least, today's moderator is Dr. Hamza Ghori, who is Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology. And I will hand over the mic towards Dr. Hamza for the proceeding of this second encounter between Aga Khan Stars and HMC Stallions. Over to Hamza, Dr. Hamza Ghori.
Thank you very much, Hamza. First of all, I would like to thank Wilson's Pharmaceutical and Pakistan Cardiac Society, along with all those people who are affiliated with this league, for putting up such a wonderful show. And it's definitely learning on the go, and it's going to be in a very playful environment. I welcome our highly esteemed council, which is here for today, along with our umpires, and it's truly a star-studded show for sure. Now, I'd like to move on to the match fixture that we have for today. As we all know, it's the second match of the league, and it's going to be between Aga Khan University Hospital Stars and HMC Stallions, Hayatabad Medical Complex Stallions. So I would like to take permission from the council to move ahead towards the match. Right, so should we go ahead?
Sure.
Right, sir. So I think before we move on, I would like both the teams to introduce themselves. Okay, so can I ask Aga Khan University Stars and their captain to give the introduction, please?
Thank you. My name is Dr. Mohammad Ahmed Tamiz, and I'm the captain of AKUH Stars. Let me introduce you to my team. On my right is Dr. Omer Javed, and on my left is Dr. Rizwan Ali Khaja. Our coach is Dr. Sayyid Bakar Ahmed, and we say but behind the camera. And one of our participants is in Peshawar right now. He's joining us via Zoom, Dr. Asfam Ali.
Okay, so best of luck to you guys. And now HMC Stallions, introductions, please.
Bismillahirrahmanirrahim. My name is Dr. Muhammad Tufail Jan, Captain HMC Stallions. To my right is Dr. Ihtisham Saeed, and to my left is Dr. Farhatullah.
So welcome and best of luck to you.
Thank you.
So
sir.
I think we all know that we are going to have 10 questions thrown on both the sides. After the end of 2 innings, we will see what the score is. So you get a 6 mark, or a sixer, I would say, if it's true and if the answer is correct, and you'll get no marks, 0 marks for giving the wrong answer. So I think first, before we start the match, we need to get the toss done, and I would like any of the volunteer teams to go for the coin toss. Who is it going to be? Or should I go for a random selection? So if nobody is willing, then I think it's going to be an electronic coin toss, and I will ask HMC Stallions. Can we have the coin toss, please, Hamza?
Yes.
So heads or tail? I can't see it on the screen.
Okay.
Can we have it on the screen?
Tail.
It is on the screen, sir.
Okay, I can't see it. Okay.
Head round.
So heads it is?
Yes.
See the screen.
So, so what do we have? Is it a heads or a tails?
It's a head.
And the winners are? Is it AKU?
Yeah, so they HMC I think called for tails, so I think we won the toss. So I think
Yes. So Aga Khan has won the toss, right? So are you going to throw the questions or are you going to take the questions?
throw the questions.
So they are going to throw the questions, right? So I think we are all set. Should we start? Hamza?
Yes, sir.
Okay, let's start. You will each have 1 minute, 30 seconds for each question. Let's start. Let the play begin.
HMC की screen आई है. HMC की presentation.
जो क्वेश्चन स्क्रीन है उसको स्क्रीन पे डाल दीजिए.
The screen is not visible yet, so we are just waiting for it.
Okay, so but I think it's going to be better if we get the screen so that everybody can see that.
Sir, I think HMC is going to present the case first.
Gigi, HMC has to present the
HMC
case first.
presentation first, please.
Okay. 30 years.
No. Aga Khan has chosen to throw first, so they will ask the question first.
Okay.
HMC is going to answer the question.
Okay.
Okay, sir.
Buzzer किधर है? Buzzer.
Hamza sir, please share the screen. We can't see the slides.
Ji. And for Hayatabad Medical Complex Stallions, you have 1 minute 30 seconds. You can take your time, and within that time, you have to then answer. So you can take your time, and there is no hurry. But giving the right answer is more important. But don't go beyond 1 minute 30 seconds. आपको timer नजर आ रहा होगा, hopefully.
But we haven't seen the question.
Sir, we have to stop for a few moments. There is some technical glitch from the Agha Khan side.
Okay.
Their laptop has suddenly stopped working.
Okay, so
Just we have to wait for 2 minutes.
okay, take your time.
Ji.
I'm sorry, I think it's a technical glitch and the technical team is taking their time.
So they are
So
just
hopefully-
changing laptop. So just
Okay.
wait for 2 or 3 minutes.
Right.
In the meantime, definitely, this is Syed Bilal Sarwar, and I'm from Head of Marketing and Sales at Wilson.
Assalamualaikum.
Professor Isaac is with us. Sir, I will request, last time you were in the batch, in the first batch, and can you please share your experience? How was it, the first match, and so far, how do you like the overall setup of this program and overall जो ये सिलसिला कार्डियक सोसाइटी की तरफ से शुरू हुआ है, आपके कुछ कमेंट्स इस पर?
Thank you very much, Bilal. I think it's an excellent idea. I was not very sure about its contents and how it's going to affect our trainees. But having attended the last session, I am very clear in my mind that this is a very good exercise. Not only it provokes their learning and reading, but also the presentation, because this is very important. They should have a proper way of communication, presentation. And one of the things that we found in FCP examination is that knowledge is there, but there's a lack of expression, and they don't know how to properly present it. So I think from that point of view, it's a very good. We will have more speakers, and we are in need of young speakers and young people who are involved in academics, because our generation is now on the go, so phasing out. But I think I'm glad that this sort of activity is really going to promote understanding and knowledge between the institutions also. So I think it's an excellent idea. I must
Thank you very much.
appreciate Wilson for sponsoring it, and all those who are involved in it need to be complimented.
Sir, I believe it's all teamwork, and Professor Feroz Memon is not here. I think he has great faith on us. Professor Bilal Mohyuddin Saab and Javed Akbar Sayal Saab, President Cardiac Society, they have shown a great faith on the overall structure of this program. And every one of them in the last meeting that we had together at during the Pakistan Live, they have all shown a very strong faith and their support to continue this program, not only for this year, but inshallah ta'ala, we are going to extend this program. We are doing this with 12 big wards and units of cardiology this year. Inshallah ta'ala, we have a program to extend this competition to like 18 to 24 team, inshallah ta'ala, in coming years.
And meanwhile, Agha Khan is online, sir.
Ji.
Okay, so we are all set.
Yes.
Okay, so can we have the question on the screen? So first question from Agha Khan, University Hospital Stars, coming to HMC Stallions.
सही होकर क्यों हो रहा है? So they will be presenting their case first and then followed by questions.
Yeah, yeah.
So we're just waiting for the scenario to appear on the screen. And yeah, we cannot see the other team also.
I can't see the screen. Share the screen.
Yes. Hamza, somebody will have to share the screen.
Okay. So can you see the screen now?
No, we can't. We can't.
सही आगे क्लियर
उस स्क्रीन को पिन करना होगा आपको जो विल्सन फार्मा के नाम से
So you need to pin this screen in order to others to see it. जो scenario है उसको आप
Yes.
pin कर.
You have. जी बिल्कुल उसको share करना होगा. Have you done that?
Yes, yes. It is visible, sir? Can you see the screen?
It is visible at
Not
HMC
yet.
side.
Bilal, may I suggest one thing, that in future we should have a practice session before the actual session starts. You see, about 15-20 minutes before, you should have practice session. This we
Absolutely, sir.
have been doing
Absolutely.
with the BMJ series also. So, टाइम से पहले थोड़ा 15 मिनट पहले आप इसको चीजों को इंस्टॉल कर लें और प्रैक्टिस सेशन करें ताकि देयर शुड बी नो हिंड्रेंस ड्यूरिंग द सेशन.
Absolutely. Absolutely. Totally
Very
agree
right,
with you,
sir.
So,
Very right, sir.
आप डायरेक्टली बोल रहे
Shall we start? We're waiting. But we cannot
सर
see
स्टिल स्क्रीन नहीं आ रहा है इधर.
we cannot see
स्क्रीन इधर नहीं आ रहा है.
Sir, you have to pin
Sir,
Wilson Pharmaceuticals.
Okay. Okay.
Okay, yes, you have to click on that and then you will have the screen. So click on that screen and now we have it. I have it.
Yes, same here. I have it.
बस सही है. सही है. बस फन भी आ गया. टाइमर इस पे आ जाएगा स्क्रीन पे.
Okay.
चलिए बता.
All right, so shall we start?
Yes, please start.
All right, so the scenario is this is a 30-year-old female, known case of familial hyperlipidemia and a history of Hodgkin's lymphoma, treated with radiation therapy to the chest 10 years ago, presents to the clinic with complaints of dyspnea, fatigue, and peripheral edema for the past 3 months, which has worsened for the past 1 week. On arrival, her blood pressure was 70/50 and her regular pulse of 130 beats per minute and saturation of 93% on linear. On physical examination, she has regular visual distension, marked pedal edema, and shifting dullness on abdominal examination, and pulsus paradoxus. ECG showed sinus tachycardia with low voltage QRS complexes, and echocardiogram reveals moderate pericardial effusion with preserved left ventricular ejection fraction. Next slide, please. So her right heart catheterization was done, which showed decreased cardiac output of 3.1 liters per minute and a cardiac index of 1.4 liters per minute per meter square, with a right atrial pressure of 34 millimeter mercury. Pericardiocentesis was done, which showed 200 ml of serous and venous fluid. Right heart catheterization after pericardiocentesis demonstrated an improved cardiac output of 5.7 liters per minute, a cardiac index of 2.9 liters per minute per meter square, and a mean right atrial pressure of 25 millimeter of mercury. So I hope you have read the scenario. So shall we move on to the questions?
Yes. I would request you to throw the first question at HMC Stallions. And we can have the screen showing the vignette and the question and the whole scenario there.
The first vignette is question is which of the following is not an indication for pericardiocentesis? Option A, recurrent pericardial effusion. Option B, concern for tamponade. Option C, large chronic effusion. Option D, suspicion for underlying neoplastic or bacterial process.
Timer.
And the timer starts now.
इसको इसको minimize कर सही है
Okay. You can see that timer, 90 seconds.
बस ये सही छोड़ दें
आओ देखिए हम उनका था तो देखिए हम विंडो जोड़ो आओ कोई मिनट जो री करने से देखना री टीम का विंडो जोड़ो suspicion the underlining of plastic bacteria suspicion component the babon ke large chronic fusion the for the first time ragale babon ke कुछ कल recurrent show करना ना babon का तरीका लगा recurrent के बार बोले के
30 seconds left.
देखिए मुझे पेरिकार्डियल विंडो जोड़ो ए दे हां नो सुनूंगा जवाब बस नो अब वो जवाब कैसे देंगे आंसर ए
So, is it final?
Yes, answer A.
Answer A.
Recurrent pericardial effusion.
All right. Okay, so Aga Khan stars. Can we have the answer?
all right so are we supposed to tell the answer because we were told that you are going to tell the answer sir
No, I think we need to mark them. So,
all right
yes.
so
Is
that's
that
the correct
answer?
good
Yes. Well done. 6 runs.
Thank you.
All right. Next question, please.
So which of the following is the hallmark of the diagnosis? Option A, pulsus paradoxus. Option B, persistently elevated right atrial pressure after pericardiocentesis. Option C, low voltage QRS complexes with electrical alternance. And option D, right ventricular free wall akinesis with sparing of the apex. Time starts now.
और right ventricular free wall akinesis with sparing of the apex the ARVC da pulsus paradoxus chicken de yo present specific low voltage खुदा टोल दा पारा दे low voltage खुदा टोल दा पारा electrical alternance पूरा pressure माने हर सचेटेड रिक्वायरमेंट के pressure माने के हां क्या से काम दे परसेप्शनल डायग्नोसिस से राजे हां मार्केट pulsus paradoxus से right ventricular free wall akinesis da means lo क्या से low voltage चीज़ कना दा खुदा नका दा पारा मुंगो cardiac component दा पारा दे दा खु पाहे पोतारेट किंदी है ना और right ventricular free wall akinesis electrical alternance swinging के होता है सी गोरा oblique होना persistently elevated right pressure after pericarditis और जंग diagnosis से दे अब दे cardiac component हो दे effusion pericarditis थे खुदा cardiomyopathy
30 seconds left. Okay, so just 15 seconds to go. Yes, less than 10. Hurry up, you'll use them.
Option
Yes.
B. Option B. Persistent
Okay.
right atrial pressure.
Option B. Right. So is that true? Aga Khan.
Yes, it is.
Well done. Oh, yes. Good job. So another 6.
Another 6.
Next question, please.
So echocardiographically, which of the following feature will suggest a moderate pericardial effusion? Echo free space of 5 to 10 millimeter, echo free space of 10 to 20 millimeter, echo free space of 20 to 30 millimeter, or echo free space of 30 to 40 millimeters.
And timer starts now.
B option D. B option D. 5 to 10 miles. 20 to 30 severe, 30 to very severe. B पके दे. 10 miles.
अभी देखता मैं ये मैच देख लो उसके बाद मैं खाना वाना खा लिया
Moderate.
मंगा लो तो
Option B. Echo free space of 10 to 20 millimeter.
Oh, that was quick. Are you sure? Should we lock?
Yes.
All right. Aga Khan. Is that true?
Yes, true.
Well done.
Well done, HMC.
3 6s in a row. Great job. And that too in quick time. So next question, please.
So post pericardiocentesis, what would be the most specific echocardiographic sign in this patient? Early diastolic RA collapse, early diastolic RV collapse, McConnell sign, or ventricular septal bounce? Timer.
McConnell sign McConnell sign the pulmonary embolism that you ventricular septal bounce what would be the most specific echocardiographic sign in this patient? Pericardiocentesis دي يكون هذا بسيط. لا شكلها pericardiocentesis وكو كولابس بختم شيء. RV كولابس بختم شو. وventricular septal bones चिकन दे करना. तब वो ले पाती की.
Glad to hear discussion in Pashto.
So good discussion. Early diastolic RA collapse. Reverse यदि करना. What would be the most specific? RA collapse होती है. ज़्यादा. अول هو RA बांधने pressure दा full नजर कमी.
30 seconds left.
McConnell ventricular. जमा बख्याल से A दे. diastolic RV collapse بآخره كرازي. What would be the most specific تدين بقى نقدر BD RV.
10 seconds.
Option B, early diastolic RV collapse.
Okay, so it's option B. Aga Khan, stars,
Wrong
is that true?
No, that's not true. The answer is D, ventricular septal bounce.
Okay, so no worries. Better luck next time. So I think you get a score of 0 on this one. All right. So the next question, please.
So next question, pericardial effusion is the accumulation of fluid between which of the following layers? Visceral and fibrous layer of the pericardium, parietal and visceral layers of the pericardium, parietal and fibrous layers of the pericardium, or myocardial and visceral layer of the pericardium. Myocardial layer or the visceral layer of the pericardium. So timer is starting late actually. Please,
Yeah, I think don't worry. You'll have equal opportunity.
Okay.
So
Option B, parietal and visceral layer of the pericardium.
So should we lock it?
Yes.
Okay, lock the answer. Aga Khan, stars. True or false?
Wrong answer.
Oh,
So the
that's
answer is
wrong one
C,
again.
parietal and fibrous layer of the pericardium.
Okay, so I think we've lost another question. No worries. So moving on to the next one.
So what is the definitive treatment in the above scenario? Pericardial window, pericardiectomy, DMARDS therapy, or pulse therapy with steroids? Timer, please.
Timer starts now.
No recurrent pericardial window, DMARDS therapy, connective tissue or rheumatic or another. Pulse therapy with steroids. Hodgkin lymphoma steroids one working. No working.